Choices. We face them every day. Now, some choices are unimportant, but some are life-changing. What if the choices you thought were small were actually the ones that mattered the most? Today, you're going to hear from some women who will share choices they're making to fight heart disease, stroke, and cardiovascular diseases. Heart disease, stroke, and other cardiovascular diseases are the leading causes of death in women nationally and right here in Rhode Island. On average, 5 women die here in the Ocean State each day. You will now meet 5 women in Rhode Island who will speak up about an issue of the heart, warning signs of a heart attack, physical activity, good nutrition, tobacco use, and how you can speak up about heart disease in your community.
Many women, even their doctors, still think that heart disease is a man's disease and do not recognize the risks. Even though more women than men die of heart disease and other cardiovascular diseases, women are less likely to receive aggressive treatment, and we are still unsure of the best treatments for women. Here are some signs that a heart attack might be happening. Chest discomfort, discomfort in areas of the upper body, shortness of breath. Other signs may include cold sweats, nausea, or lightheadedness. As with men, women's most common heart attack symptom is chest pain or discomfort, but women are more likely than men to experience some other common symptom, particularly shortness of breath, nausea and vomiting, back or jaw pain. Even if you only have just one of these symptoms, or if your symptoms should go away, you need to call 911 immediately. An emergency medical service team can begin treatment as soon as they arrive. This means you can get treated faster than if you arrive to the hospital by car. If appropriate, begin CPR and continue until EMS arrives. As a cardiac nurse, I make it my personal goal to teach thousands of people the basics of CPR every year. Many of these classes are using the American Heart Association's CPR Anytime Kit. I choose to live by knowing the warning signs of heart attack and stroke, the importance of calling 911, and by teaching these facts and CPR to the community members throughout Rhode Island.
Stop smoking. Smoking is the most preventable cause of death in the United States. If you smoke cigarettes or cigars, you have a higher risk of illness and death from heart attack, stroke, and other diseases. These include lung, mouth, throat cancer, chronic lung disease, heart failure, and vascular disease in the legs and arms. Constant exposure to others' tobacco smoke increases your risk, even if you don't smoke. The good news is that when you stop smoking, your risk of heart disease and stroke can be cut in half in just 1 year and continues to decline until it's as low as a non-smoker's risk. At the Urban League of Rhode Island, through advocacy and community service, we continually strive to creating a smoke-free Rhode Island. I choose to live by staying smoke-free.
La inactividad física te pone a riesgo de un ataque al corazón. Couch potatoes, listen up. If you are physically inactive, you're much more likely to develop heart disease or have a stroke. Regular physical activity helps reduce your risk of heart disease and stroke. Exercise can help you lower your blood cholesterol, diabetes, and obesity. It can also help lower your blood pressure. The American Heart Association recommends at least 30 minutes of physical activity on most or all days of the week to condition your heart and lungs. I am the director of the health programs at the Center for Hispanic Policy and Advocacy, CHISPA. I supervise the health promoters, Promotoras de Salud program. We educate the Latino community on cardiovascular disease and run El Club de la Salud. El Club is an opportunity for our community to exercise with Zumba, a fusion of salsa and aerobics to a Latino beat. Come join us. I choose to live by doing Zumba 3 times a week. Cuida tu corazón.
Grilled or fried? Go with grilled. Small changes in the way you prepare food can have a real impact on your health. Eating well is just one step to help reduce your risk of heart disease and stroke. Look for heart-healthy recipes that include fruits, vegetables, and whole grains. Limit foods high in saturated fats, sugars, and calories. Healthy choices will help you feel better, look better, and give you a boost of energy for your busy life. When I was a teenager, I had 2 heart surgeries. Since then, I've had to rethink my everyday food choices. Now, I do my best to eat at least 5 servings of fruits and vegetables a day. I choose to live by making good food choices today that will have long-lasting impact on my heart health.
Hey folks, speak up! The good news is that by speaking up and taking action, we can beat the statistics. As a small business owner and member of the American Heart Association Board of Directors in Rhode Island, I know that when leaders speak up and make health a priority, many tend to follow. There are many ways you can become an advocate for women's heart health. Taking care of you is the first priority. Get empowered with the facts, find a community of support, and make healthy changes to your diet and exercise. Then, spread the word to those you love, your neighbor, your friend, your coworker, your mother or your sister. Because when you speak up, you can help save lives. At GladWorks, we work to promote healthy lifestyles with our employees. To do this, I've shared the message of taking time to take care of yourself and how important good nutrition, regular exercise, and overall healthy habits are. And if that message can make a difference for even one team member, well, we consider our company to be a happier and healthier one. And that is, after all, our ultimate goal. I choose to live by speaking up. And I'm proud to speak up about cardiovascular health in both my community and in my workplace.
Your heart is in your hands. Heart disease is largely preventable if you lower your risk. You need to know the ABCs. Avoid tobacco. Be more active. Choose good nutrition. Also, know the warning signs of a heart attack and call 911 immediately. Now, making the right lifestyle choices is essential to living a heart-healthy life. Choose to speak up about heart health in your community and make a difference. Get started today. Visit GoRedForWomen.org and choose to live healthy.